Welcome to Late Night Health with Dr. Greg Celaya and me. I'm Mark Alyn. This is a program that cares about the most important part of your life, your health. During the next 10 to 15 minutes, we're going to talk about peripheral neuropathy. That's the tingling in your hands and your feet that often is accompanied by diabetes, but there can be other causes of it as well. We're going to find out now from Dr. Greg Celaya, who's a functional medicine specialist, nutritionist, and an all-around nice guy. Dr. Celaya, am I right that peripheral neuropathy often comes from diabetes?
Yeah, you are right. Diabetes is the number one cause. I was talking to a patient yesterday and he was asking me about peripheral neuropathy and what can be done. And I realized I didn't do a video on it. So here we are.
Got it. That makes sense. Actually, the other day I saw a supplement being advertised for it.
There's plenty, but you have to understand the root causes of peripheral neuropathy. And boy, there's a lot of scenarios, and people have to understand it's usually not one of those things that comes overnight, though there are acute versions of it. Usually it's something over time that has happened, and usually it's a coordinated effort of a lot of different things. It's usually not just one thing that you have the smoking gun, because if there were, we wouldn't even be talking about it at this point.
So let's take a look at what this is exactly. If somebody has neuropathy, I described it as a tingling in the hands and feet, but it can be painful as well.
Yeah, you have the central nervous system, you have the peripheral nervous system, and this affects the peripheral nervous system. So mainly the extremities, right? The arms, the legs, and so on. And you have different portions of those nerves. You have sensory and you have motor. And if it affects the motor portion of it, you may have weakness. If it affects the sensory portion of it, you may have pain, numbness, tingling, those types of symptoms. So it can affect different portions of your nerves.
What is the root cause of peripheral neuropathy?
Well, it happens to be that the nerve itself is damaged, and so it's not functioning properly. And there's several different reasons, and one of them could be inflammatory, oxidative stress, or you've heard of mitochondrial dysfunction before, and that is one of them as well.
We have mitochondria in our lungs, don't we? In the cells of the lungs, they kind of wave back and forth and take in oxygen.
No, that's yes and no. We have mitochondria that help create energy for the cells.
I see.
It's they're in every cell. It's more known for the muscle cells.
Got it. All right. So would it be good to say that what happens is that the nerve gets damaged because of something off balance within the body?
Yeah, like I mentioned, inflammatory, oxidative stress, or mitochondrial dysfunction. So if the powerhouse of the cell isn't working properly, of course, you're not going to get the energy and the cell's not going to function properly.
Okay. How do I avoid this, or how do I get it?
Well, I mean, there's so many different reasons. And one of them is a mechanical standpoint. So you have a nerve compression. And nerve compression can be in the lower back. It can be in the knees. It can be in the ankles. It can be in the shoulders, the neck. You see what I'm saying?
Sure.
Anywhere that there is a possibility of a nerve or nerves being compressed is the possibility you may have peripheral neuropathy. And so that's a little bit of an easier scenario to make sure you address. And if you do have it, having chiropractic treatment can make a big difference, and especially decompression type of treatments, which are great for PN.
And what's a decompression kind of a treatment? What would that be?
It's a type of computerized traction, and we found in my office, which is great. We've got some phenomenal chiropractors there, treating these issues, peripheral neuropathies and disc issues with decompression can make a difference if it is a compression type of problem. And not all peripheral neuropathies are compression, though.
And so what that means to me as a layperson is that there's something pressing on a nerve?
Yeah, exactly. That's exactly it.
Okay. And the chiropractic adjustment releases that pressure.
It can, like I said, more so the decompression type of therapy.
Right.
And, having the right tests, the MRIs are real important to make sure you understand, but also NCVs or EMG type of testing where you're testing the nerve function down the course of the entire nerve. So like I said, if we're looking at lower extremities, you could have a problem with lower back, you could have a problem with knees, you could have a problem with ankles. And it's very common to have ankle issues and have peripheral neuropathies.
I just have small ankles, so I can't ice skate.
That's a good excuse, but yeah.
Yeah, there's another reason I can't ice skate. You want to know what that is?
What is it?
I'm not coordinated.
Oh.
All right. But this, I'm making light, but this is a serious issue. If you don't have full function of your nerves, if they're not functioning 100%, I can see a number of problems, like you're walking and you don't feel that you're walking.
Yeah, it can be a serious thing, especially when people are experiencing pain. It becomes a real problem. So there's so many more different issues that you have to look at. So chemotherapy medications and regular medications, even the statins have been reported to maybe cause some of these peripheral neuropathies.
Do traditional doctors recognize that these problems can happen from the pharmaceuticals?
Well, of course they do. And, but there are certain pharmaceuticals that they use to treat this. Like, for example, have you ever heard of Lyrica before?
Yeah, sure.
So it's a medication that they really don't know what it does, but it helps with peripheral neuropathies. And
oh boy.
Well, the problem is it does a lot of other things, but if you look at the side effect list, it may not be worth it to you.
I was watching TV the other night, and I do watch the pharmaceutical ads. I don't even care what what it's supposed to cure or prevent or stop or whatever, but the list of side effects: death, loss of hearing, blindness, constipation, diarrhea. The list goes on and on. Why would anybody want that?
Well, the problem is these medications are out there, and they shouldn't be a first line of type of treatment, and they are for a lot of people. But yeah, why would you go down that path when you haven't exhausted everything else? So, for example, thyroid issues can cause PN, and we'll just use PN because it's simple.
Sure.
Autoimmune conditions. That you have Sjögren's, you have rheumatoid arthritis, and you have lupus. Those are real common ones that can cause or have a side effect, so to speak, of PN.
I had a teacher who lost all feeling in his hands. He couldn't feel his hands. He could move them. He had trouble picking things up. Would that be a severe form of NP?
Well, it could be, but there is more that it could be as well. I mean, there's so many different diseases that can cause some of those symptoms to occur. You just don't want to ever assume, right? I mean, that's a little bit different. Usually, not always, but usually you're seeing them in the feet, which is a more prone thing. So if there's muscle issues, there's other autoimmune conditions that can cause these things to occur also.
If somebody is feeling that tingling in their feet, in their hands, in their ankles, as you said, in their legs, and there's not a lot of pain, should they ignore it, or should they bring it to the attention of their healthcare provider?
No, you should never ignore it because it may be something simple. You know how we talked about MTHFR before?
Yes.
You can also end up with B12 issues. And these type of conditions can be huge. And B12 is a huge deficiency for PN, right? So as we age, the cells that produce intrinsic factor that make it so your body absorbs B12 get less efficient, and you're not absorbing the B12. And so that alone can create problems. Folic acid can create problems. B1, B6.
Too much or lack of?
Lack of. And if you look at B12s, there's different forms, but the most common form is with a carrier of cyanide, which, you understand cyanide and how it's really
That's a poison, isn't it?
Exactly, as a poison. So if you're going to look at B12, you want to look at the methyl, the hydro, or the adeno forms, which are quite a bit different. And research has not shown which one of those three is good for us at this point or the best. So we even have certain supplements that contain them all so we can figure out what the research, but you want to stay away from the cyanide form.
There's a cyanide form of B12.
Absolutely.
Oh my goodness.
Absolutely. And so, we also talked about glutathione, and low glutathione can create low B12 as well.
Oh, that's amazing. And B12 is, I mean, I think they still do in traditional medicine, give B12 shots to boost your energy.
Sure. And, if you look at research, if you get a good quality pill, it's about the same as a B12 injection. Now, if you're really, really bad and you have a lot of peripheral neuropathy, an injection may make a little bit more of a difference because it may get there quicker. Who knows? I don't know. But the research I've seen says it's about the same. And also eating gluten. Mark, eating gluten can become a problem here.
And gluten is in everything from ice cream to bread. It's used as a thickener in ice cream. It makes no sense to me.
Absolutely. Heavy metal toxicity. And so I see a lot of heavy metals. In fact, we should talk about heavy metals here in the future and how we look at them, how we test, and how we treat.
Okay, we will do that. So the first thing to do if you're feeling that tingling and it's just not normal. I mean, everybody has their feet fall asleep. You're sitting down in a funny position. You cross your legs. You even sitting on the potty for a long period of time can cause your feet from falling asleep because you're blocking the blood flow.
Well, it's more pressure on nerves. And, but now that you do bring it up, if you do have circulatory issues, that could create PN as well. You have environmental toxins and molds that can create it as another fact. Kidney issues. And here's a good one, sleep issues. And adrenal problems can help contribute towards peripheral neuropathies.
What do you mean by sleep issues? Not getting enough?
Correct. Not getting enough for the wrong time. Absolutely.
What do you mean the wrong time?
Well, remember we talked about the circadian rhythm, and you have to follow your body's rhythm or the natural rhythm of how the sunlight and everything affects your brain.
Right.
Well, the problem is that we sit there at night and we avoid the circadian rhythm by sitting in front of the computer. We're working on cell phones and we're amongst a bunch of light and blue light, in fact. And therefore, we're not really paying attention to the circadian rhythm, which can affect the adrenals and therefore more issues dealing with sugars, like we talked about diabetes.
What about on the computers? There are now night screens.
That is better, but still, it still becomes an issue.
Okay, got it. So when you go to your doctor, do you say, my feet are tingling, I need to be tested?
Yeah, it's a good start because just because your feet are tingling doesn't mean you have a true peripheral neuropathy. You may and you may not. I mean, a lot of people, they tend to notice it when it causes them pain. And that might be a little bit too late, right? I mean, it's never too late, but you want to try and catch it earlier. So absolutely. And the right type of testing is important. And the problem is that most doctors just stop at real basic testing.
And they don't delve into it. What about, an MRI? Can an MRI show nerve damage?
An MRI can give us an understanding if there's any type of compression at the spinal level. If you want to take a look a little further, you would do an EMG test to determine how those nerves are functioning all the way down the course of that nerve. And that's a real good test. It may not be the most comfortable, but it is good. There's also blood testing that you can do. We see very frequently that a lot of doctors test serum B12, and it's not a real good test for vitamin B. You want to look at something called methylmalonic acid. And there's a new test also, or it's newer, and it's called HoloTC, which is another great test for understanding B12.
Are traditional doctors using these tests?
Usually not. I saw one yesterday that ran a methylmalonic acid, which is very rare. And I commend him because it's great. It's a big difference. The other thing we want to take a look at is homocysteine.
And what is homocysteine?
Homocysteine is an amino acid. And basically, when we see issues with B12, we can have a homocysteine problem. And it's also indicated in cardiovascular disease.
I wanted to talk about the B12 again. because that's a concern. Uh, where is B12 from? What is it usually made from? And while you're telling us that, I'm going to run and get my bottle, which is like 4 feet away.
All right, so B12, you're going to find it mainly in your meats, and especially your red meats, which are great. Real important supplement because it's there for everything. And we can have so many issues when we're having a B12 deficiency. And you've heard of anemia as well,
right?
Let's see what does your bottle say?
It says
methylcobalamin.
Yeah, what you said.
Yeah, good. It seems to be a reasonable form. But I'm sure you didn't get a cheapy form, and that's usually, the other ones are, like I said, they're cyanide based.
Right. This one, my only problem with it, and most of the B12s that I've found have a cherry flavor. And I don't know why. I've tried to find one without the cherry flavor and haven't been successful.
And so what's your problem?
I don't like the flavor.
Oh, well, yeah, you're kind of picky, aren't you?
Yeah, I am picky.
And you know what? It's the reason it's a sublingual is because they're not depending upon the intrinsic factor really to digest this stuff, which is great. So it's going right into your system. And that's why you see it commonly in that type of form.
Got it. And I'm sure that they have other flavors. I just take it, I take it on a regular basis.
Sure. And so your diet's important. And we see a lot of problems with vegans because they're not getting the B12. And going back to tests, we have something called FIGLU, and that's another important test. So there's a lot of great tests. In fact, a real good test that I like to see, especially in a case like this, is we're looking at the Krebs cycle intermediaries within the mitochondria. It's what we call an organic acid test, and it's wonderful for understanding some of how your body is utilizing or not utilizing energy within the cell.
Have you personally had these tests?
Mark, I've had every test I ever suggest to patients. I have them first. And, most labs don't cut me a deal on labs, buying them for myself. And so I feel that they're that important, number one, to have, and number two, to be able to understand. So yes, I've had an organic acid test. You betcha.
Do you have your kids and your wife do the testing too?
I do a lot of tests on my family because it helps me understand things a little bit better as well, not to mention with patients.
Got it. That makes perfect sense. As we wrap up our time together on this episode, what are a couple of things that people should do about peripheral neuropathy?
Well, I mean, it goes down to diet. You want to make sure your diet is appropriate, and there's so many people that are not. Exercise has to be a certain amount. Too much or too little is a problem. But you want to improve your metabolic health by exercise. We have N-acetylcysteine, which is a precursor to glutathione. We have selenium, and we have carnitine and lipoic acid that can make a difference. Now, those aren't the only things. And how do you know whether to take them or not? Because taking too many things is a problem just as much as not having enough. So doing the right testing makes a big difference. And when you hit this with a complete full prong approach, the mechanical and the biochemical, and even the genetic aspect of it, you can really make a big difference with this problem.
And the problem usually shows up in older people, or is it not age related?
It depends upon the reason, right? So some of the biomechanical issues can be at any age, depending upon what's going on with you. So a lot of athletes may have it due to the traumas they've had in their past. Some of the biochemical issues can become later, but they can be younger too, but mainly later. But when somebody has it, it is devastating for them. I mean, you can imagine having so much pain in your extremities that you can't even sleep. And I see this all the time.
Yeah, right. So if you're suffering from NP, right, PN, peripheral neuropathy, I got those messed up, peripheral neuropathy, or you think you might, or you just want to know what condition you're in, I've got a suggestion for you. Go to drcelaya.com, drcelaya.com. Look around, explore lots of good things. And the most important is that Dr. Celaya will give you a free 15-minute consultation over the internet, over Zoom or Skype, whatever you want. And I think that's really well worth it. This guy knows his stuff. He really does. Dr. Celaya, thank you for joining me again today.
Thanks, Mark. It's great to talk to you. And, I hope this video can make a difference with people with peripheral neuropathy, because I've seen a lot of it and it's a tough one. So if you have any questions, go to my website and schedule for a free 15-minute consultation, or even become a new patient. I'd love to help you.
I'm Mark Alyn for Dr. Greg Celaya. We'll see you next time.